number of people in my area who are expressing interest in the fermented Chinese tea kombucha. Can any of you make any comments about that preparation?
So, I mean, it's interesting. There's a number of teas. Also, the guy who wrote the book Anti-Cancer, which is really a very reasonable book to recommend to patients, Anti-Cancer, A New Way of Life, he got focused into sencha tea. So it's unclear that there's something special about these teas. It does seem like those flavonoids that we've looked at as the active ingredient are highest in green tea. Whether kombucha is better than sencha is better than, Lipton green is sort of unclear. Lots of patients ask me about organic, and that's the one thing I do push a little bit on tea if it's sort of within their price point range. That probably with teas, because they're dried leaves, you're getting more concentration of pesticides and other things. So I sort of tell patients, if they want to do a specific tea, great. I don't know that it's any better than other green teas, and there may be some evidence that like white teas and black teas have the same effects. So I just encourage patients to drink tea, and if they can, to drink organic tea.
Can you comment on the duration of effect from acupuncture? Is it very variable, or?
So the question is duration of effect. Yeah, it's a good question. It depends on, again, the acute nature of the symptom you're treating. There are some situations where one session takes care of an acute problem and it never comes back. Since most of the things in oncology that we're confronting are chronic, that's not going to be the case. And usually people will need to have repetitive sessions. If you are seeing someone who's new and they have a particular issue, like say hot flashes, you may alleviate their hot flashes initially for a few days, but they'll come back. But as you re-treat them over time, it will become a permanent issue. So that would be a successful intervention in that setting.
I have two questions, one for AK and one for Diljit. But so we're lucky at Anderson that we do have a certified acupuncturist in the building. But how do you know where to send somebody if you don't? How do you know who's a good acupuncturist? And then Diljit, we need you to give us something. so I had asked another integrative person, of all the things, is there anything that you would recommend? And he said, I really can't recommend a lot, but I would tell people to take vitamin D and fish oil. And then one more comment for all of you about the new aspirin data that's out there.
Okay, mine's easy. I actually, either because I know someone personally, that would be one way. I send a lot of people to my teacher. But as a general rule, what I recommend is finding the local acupuncture school, and they will usually have a list of people that they recommend by geography, and that's how I do it.
So I do feel like the diet recommendations and the lifestyle, and I do talk to every single patient about just doing one change in their diet at a time, whether it's add the fruits and vegetables, whether it's add some fish twice a week. I do talk to every single one of my patients about exercising and even just walking 20 to 30 minutes 5 times a week. And then I talk to everybody about stress management, and sort of being very conscious. And I often teach them a little breath technique. There's like a 4-7-8 breath. There's some really, easy things that you could teach them. But if you really want things in bottles, so what do I think? I do make sure people's vitamin D levels are somewhere between 30 and 50. So I check everyone's vitamin D, and if they're under that, I supplement them and try to get them up to that. It's a tricky thing, the vitamin D, what's good and what's bad and what level's safe has gone around a lot. And we were doing some really high, getting people really high. Then there was a pancreatic cancer study that showed increased rates of pancreatic cancer in people with vitamin D levels over 60. So I sort of stay in this 30 to 50 range. I do recommend fish oil, and I think that it's tricky during chemotherapy. There's some platinum studies that show high doses of fish oil in vitro settings might hinder the effectiveness of platinum. Now, that's, petri dish stuff, and what does it mean in the real person? So when someone's on platinum, I don't have them do fish oil, but I encourage them to have seafood in their diet, 2 to 3 servings a week. Otherwise, I use fish oil, and as somebody who's a vegetarian, I have them do flaxseed to get their omega-3s and olive oil and other things. There's other ways to get like non-fish sources of omega-3s. I actually, talk to a lot, and I think there's clear-cut evidence there's no downside to curcumin supplementation. And so I've used that in BRCA patients who are at high risk for cancer, and I've used it in patients who are getting treated. I find that lung cancer data really interesting because it was about platinum, and we use a lot of platinum, and so I also, in patients who really, really want or are seeing a naturopath and they feel like they need a supplement, I've used astragalus. I've used the Nature's Way brand of astragalus.
We've all discussed, though, that if you can tell patients it's much better to get their vitamins from food than it is to take a pill. Supplements, all these studies are done on supplements, and we don't know if there's something about taking a supplement that's not beneficial as opposed to getting it from your food.
Right. I don't recommend a multivitamin most of the time, unless people really are taking it. Do you want to do the answer question?
The aspirin question, I love that this new data is out on the aspirin, but I think time will tell. I think we've all sort of been through so many generations of announcements that there's one magic pill out there that's going to help us. I mean, it's nice. It seems that there's good science behind the idea that aspirin would be a useful drug. There's definitely pre-existing data that supports it.
So, AK, Jack Nash from Central Pennsylvania. I know that all the patients in Boston are thin and go to Whole Foods, and so this is probably a very ignorant question on my part, but in the massive obesity epidemic that I deal with in Central Pennsylvania, there's no Whole Foods there, and McDonald's and everything else, is there a differential response to the massively obese in acupuncture? Probably a real ignorant question. Are these points right on the surface, or do you have to go down 3 inches?
That's a wonderful question. It's not ignorant at all. Actually, there's different size needles, just like trocars and laparoscopy. So.
You're kidding, aren't you?
I'm not.
So you have the chew point, or what do you call it? Chi?
The sun. Yeah. So basically, the Chinese inch is about measuring where someone's, say, pericardium 6 is, or whichever point you're looking for. You measure it from certain bony prominences and certain creases. If you go, I'll give you one of these.
So how far down do you have to go?
Right. No, that's a different setting. So in terms of the depth of penetration, it depends on what you're after. So there's certain conditions where just skin stimulation will give you a response. Then there are different levels going all the way down to the fascia, which is a little terrifying because that's where you can really get into complications if you're not an expert, where for, say, very deep pain, you might actually really try and get down to the fascia. And that's done commonly on the stomach points and on the back points. So you choose your needle, and a lot of the choosing is depending on your patient. And because this is a very clinical practice, you will first palpate and do pressure and see if you have a response, see what kind of reaction you have. And when you find the right spot, at that point you place your needle. And then there are some practitioners who will place the needle till they get something called a de chi reaction, which is almost sort of an electric shock, like when you hit your funny bone. There's, of course,
that's when the patients go, de chi.
Yeah. There's differences of opinion. Traditional Chinese acupuncture, TCM, traditional, really like to get that, funny bone zing. Japanese acupuncturists are all about being very, very gentle and very, very superficial. So you're going to have different theories. But yeah, so there's different size needles.
So thank you all for joining us and for participating this morning. If you're planning on attending the ovarian session, it's in Ballroom D. Thank you.